So a really warm welcome to all of you in this Saturday evening to discuss a very, very important topic, vaccination for older adults. And to discuss all about it and tell us, what is the advantage of it and why should older adults get vaccinated, we have Dr. Prem Narasimhan, who's not a who's quite a familiar face for most of our members and for people within the Silver Talkies communities. So thank you for being here, Dr. Prem. And so the reason we are doing this Ask Me Anything session is because vaccines are especially important for older adults. And as you get older, as you know, our immune system weakens and it can be more difficult to fight off infections. So you are more likely to get diseases like flu, pneumonia, influenza, and a host of other complications that can lead to long-term illness or hospitalization without vaccines. And so this is the reason for this Ask Me Anything session, where we'll actually ask Dr. Narasimhan about all the aging immune system and why vaccinations are so important. So this is a session which is open to caregivers, to older adults, to their children, to anybody. So we are hoping more people will join us to hear out this really important topic. So as most of you know, Dr. Narasimhan has been an expert with Silver Talkies for a very long time now. You may have read the articles written by him in our digital magazine. You have obviously attended sessions that he has done with us. He is a chief consultant in geriatric medicine in the Department of Geriatric Medicine, Jaslok Hospital in Mumbai. And it's something that he set up. His major objective is to establish a strong framework for His major objective is to establish a strong framework for holistic elderly care through comprehensive multidisciplinary assessment and interventions both in the hospital and at home. Like we told you, he started the Department of Geriatric Medicine, which is the first of its kind in South Mumbai. And he is also associated with the Graceful Living initiative in a leadership role. He has actually been very instrumental in organizing support groups for older adults, lectures and camps, and various other initiatives towards their well-being. He is an MD in Geriatric Medicine from Amrita Institute of Medical Sciences in Kochi, and he has done senior residency at the Department of Geriatric Medicine at AIIMS, Delhi. So welcome here, Doctor.
Yeah, so good evening, everybody. And of course, on a very lovely Saturday evening, I'm sure across India, there are different weathers which are going around. Some might be bothersome, some might be nice. We always have thought about vaccination. We have talked about vaccination, but we haven't taken that as such until unless actually COVID came in. And that is when you can say something which was building up, maybe it became into a very nice knowledge blast. And ultimately people who did not, I won't say believe in vaccination, but did not have the knowledge about its advantages, even reconsidered the fact that it might actually be helpful. And I think maybe that is one of the silver linings of COVID, in which you actually thought about that vaccination is not only for younger people, and it is definitely has a very important role. And it's always nice to be on the Silver Talkies platform, in whatever way. I mean, even articles and also in person. So as you see, this beautiful green slide, it's for vaccination in older adults. So always, it's not that only young people are, even old people are worried of the needle. So it's always asked whether the needle is necessary. So that is always the question which comes up into older people's minds, and obviously, because when we are children, I don't think it's something which is asked to us. It's something which we are given, and I don't think as a child I analyzed that I should get DPT. It was just in the immunization schedule, so that's why I got it. I'm sure you got the BCG in a similar way, and the other vaccinations because it was in the schedule. Our parents took us, and then we took it. But it was pleasing that we also have a bit of a schedule. At the same time, at least certain vaccinations which we should take. Now it's a very simple thing. As we get older, we know that if we are 80 years old, 70 years old, or 60 years old, we are actually not only old as an age, but even our body is aging. So the immune system, that is the fighting system of our body, which responds to any infections, which responds to anything which attacks our body, does not respond as quickly as we get older as compared to earlier. So that's why we need to sort of up to date it. And this is done through vaccines. It could be done through boosters for enhanced protection. Then another important thing is that there are vaccine preventable diseases. So especially like pneumonia, then even shingles. I mean, shingles, that is herpes zoster, can be very, very painful. A lot of older people actually get it. They really suffer through almost maybe, I mean, I've seen almost for around 18 months till they actually get relief. And of course, flu and pneumonia, which is as well. So both of them can cause serious pneumonia, that is influenza as well as the pneumococcal, which is the organism. So it's a vaccine preventable disease to a certain extent. So vaccines can obviously help. So it's like flu, pneumonia, shingles, and many other dangerous diseases. Now, of course, as I mentioned, vaccination really gained momentum for older people after the COVID pandemic. I'm not very sure if I can say it after the COVID pandemic. We have not ended yet, but I hope that the worst days are over. But the real sort of thought process of getting vaccinated in a way wherein a national program was actually sort of, I mean, in a way, it was a national program launched in which all age groups sort of were even vaccinated, starting from, of course, the vulnerable, that is the older people, and then healthcare workers. So it became really prominent, and I'm sure you even tried to find out more. Now, I don't think anybody does this anymore, but there are still certain people who still feel that because vaccination is always talked about when we are children. So, because there's an immunization schedule, so people often mistaken that vaccines are only for children, and that is absolutely not the case. Because for various conditions, you might have to be vaccinated. So, for example, if you have a kidney disease, then you might have to be vaccinated for certain specific vaccinations as well. When you travel, you might have to be vaccinated for certain things. So you cannot say that it's only for children. Then older adults always have a higher risk of complications from the various vaccine preventable diseases. So hence they should get vaccinated. I mean, it's almost a cliche always that we say prevention is better than cure. So treating a pneumonia is much, much more difficult as compared to trying to prevent it. Now, if you give your immune system an impetus that there is an extra protection that you can fight pneumonia better, then obviously you give yourself a better chance. Now, this is a practical thing. The third point: some older people, these are the barriers. Some older adults actually face mobility issues. So it's not that they don't want to get vaccinated, because the vaccination is maybe they have to go to the hospital or they have to go to even a clinic and they're not that mobile. So a lot of times it was becoming difficult. So of course, more and more times, according to the safety, we are encouraging vaccination, at least in clinics, or at least when it is under surveillance, where there's a nurse, where there's a doctor, even in the society, if it can be sort of organized. But ideal place to get vaccination would always be a hospital, because when any injection is given, I mean, vaccination is also an injection, so one has to monitor you closely whether there are any issues. Now, if you see in overall, I mean, this beautiful, complicated looking, simple diagram, if I have to say that, uh, it's why I'm saying simple, because the word barriers is very much clicking. So, what can stop you from actually taking vaccination? One is inadequate surveillance system. So, okay, fine, everybody keeps saying vaccination, 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 but what are the studies about? How many people are vaccinated? What is the need of vaccination? So, where that is where the I mean, the solution is have more studies. Then, of course, you have already seen there was a lot of networking which happened during the COVID time. There was networking between offices, there was networking between housing societies and hospitals, there was networking between academic colleges and housing societies, elder communities, and doctors and doctor communities, in which we were able to sort of overcome this barrier and try to reach you the vaccination. Then they keep saying, of course, absence of national guidelines. I mean, the guidelines are basically a guideline for you that these vaccinations have to be taken. Like for children, there is a schedule. So obviously, we are trying to work more hard in actually getting even a schedule for older adults. Then lack of recommendation by the healthcare people itself. It's not much now, I think, because more and more doctors are recommending older people to actually take vaccinations. So how will it change? It will obviously change with a very nice vaccination awareness campaigns. People, people, especially older people who are have taken it, are themselves going to be advocates of the same. Now, for example, we have a tobacco. There is a very good campaign about tobacco, which includes Rahul Dravid, the cricketer. So that says if you drink, you want to get out. You don't want to get run out in life. So if you keep smoking, if you keep so simpler language, but in a medium where older adults and their caregivers can understand, would obviously give more transparency, because it's not only okay in telling the older adults, yeah, you should take vaccination, but they are obviously, if you have any doubts about whether you should take it or not, then there has to be clarity in that. So gaining public trust will only happen through information and transparency. So that's why I said the more information we give you about what happens when you're vaccinated, or whether it is good or bad, the more it actually will help you out. Because there's a great hesitancy, even in COVID. I mean, initially, we were the ones who took it first because we were the healthcare workers, and we were working closely with sort of the COVID patients. And then along with us, of course, next were the older adults, about vulnerable older adults, about 60, who are multiple diseases as well. So but a lot of times there was an hesitancy that should we take it, should we not take it? And this is purely on COVID. But the flu vaccination and the pneumococcal, that is the pneumonia vaccination, has been there for a long time. Then, is there a barrier of access? So, okay, you want to take a vaccination, but it's not available around. Who do you have to go to? Does the doctor write to you? Whether you can just walk into a hospital and say, no, I want a vaccination so I can take it. Yeah, of course, always a doctor has to sort of write it. So it is our responsibility from a hospital perspective and a governance perspective also, that we are able to provide you better access, because you might want to take it, but if there is no access, how will you do? Then a lot of times there were missed opportunities to vaccinate. Now, can you believe that there was a lot of vaccination which was provided free, of course, during COVID, and a lot of it was not taken. I mean, the numbers didn't sort of match up maybe with the vaccinations. So what was the sort of hesitancy in that is obviously maybe because the older adults were not entirely convinced. And this is not all the older adults, there's a certain section of older adults. Then of course, discrimination and cost issues. Now, for example, the role of older adults in society is very important. That's why I said that when you actually take the vaccination and you vouch for it, you are actually motivating more people to actually do it. So you are the ones who are sort of the beacons of a vaccination, rather than only the doctor telling that you have to take the vaccination. And yeah, of course, I think cost benefit analysis will always be very important, because cost effectivity is something which is an important part. So this was just a slide in which I wanted to tell you that even it's not about only whether the vaccine is good or bad. It's about the fact that so many things can matter in your thought process, that it is not always the vaccine which you don't want to give. It's maybe the vaccine which you want to take, but you don't have access to it. Okay, so what are the vaccines available? So there are plenty, but one of the very important ones is the influenza or the flu shot. So it, of course, protects you from serious illnesses from the yearly flu viruses. So all older adults ideally should get a flu vaccine if they're above 60 years. But specifically as well, if your people are in nursing home, if people have serious health issues like heart disease, diabetes, asthma, then lung disease, even immunosuppression through HIV, then you should definitely take. Then caregivers of older adults, because this helps them avoid spreading the flu. So, for example, caregivers, I mean, we know that there are 75-year-old might be taken care by a 65-year-old husband or a wife or a brother or a sister. So it's not always that a younger person is the one who's taking, are very, very important Then, of course, if you have had a history of allergic, as I said, new strains of the flu develop all the time. So that's why you should take it maybe once in a year. Serious illnesses, because pneumonia is one of the most common causes of admissions in older people, and it can cause serious infections in the lungs. It might actually even cause infection in the blood and in the brain. So here again, anyone 65 years and above, even 60 years and above, you might. So yeah, so as I was saying, there are two types of vaccinations in the pneumococcal one. One is of course the PPSV23 and one is the PCV13. So I'll just talk about the fact that you have to take it, and it usually lasts you around 5 to 10 years, which is good. Then again, as I said, if you have any kind of long-term history of steroid, if you have had cancer, maybe a history of chemotherapy, radiotherapy, or there is an organ known as spleen. So if you have had a history of removal of spleen, then also you should be sort of taking the vaccine. Now, zoster again is a very important vaccination. It's not, I won't say that it has been taken very rampantly in India. No, it's not. But it is recommended that for adults above 60 years of age, regardless of whether they report a previous episode of herpes zoster, it would protect you, because after getting zoster, it's really, really painful because it actually involves the nerve. So it can really be bothersome for the older people. Okay, so now, I mean, of course, the big COVID one, which most of us would have taken. Uh, as of now, it's a developing vaccine, so I cannot just tell you that how many times you might actually have to take it, but most of us must have taken it maybe at least one booster. A lot of people who are abroad have already taken four, so it's almost like first dose, second dose, and two boosters as well. So how we are, maybe we are hoping that if we limit the spread of the COVID-19, maybe there won't be more strains. So maybe if in future it might be just like influenza, where you might actually have to take an yearly vaccine. I mean, we should be happy as a healthcare person that, okay, fine, maybe an yearly vaccine might be needed. But I think it's too early to say that no, we might have to take boosters every year, or we might have to not need boosters. So it's still development. I mean, we are still not out of the pandemic yet. Now, one of the very common questions and tensions that everybody has about vaccination is the side effects. Yes, there can be side effects. There could be pain, swelling, redness where the shot was given. So we always say, do not keep rubbing it, do not ice it, do not do anything like that. If you only have pain, then it should go off in some time. If it is redness, swelling, and you have a mild fever, chills, then obviously you have to report it. If you're feeling, you might feel very tired. That can happen. A lot of people with COVID vaccines and even the other vaccines were tired, maybe had a bit of headache also for some time, but it sort of improved. Usually it might just last for around 24 hours. And muscles and joint aches as well. Now, this usually is the sort of, you can say, WHO approved vaccination schedule, especially for, I can say, for adults age 19 or years. But of course, we're not talking about that. We are basically trying to talk about age above 60. So usually influenza is one in which obviously you will need sort of one dose annually. In India, we do not do a lot of, I mean, a tetanus booster surely after 10 years. What we have always done is if we get injured, then we tend to take a tetanus shot. And if that lasts you for 10 years, then that's good. Uh, then Zoster, of course, it's a single dose. Measles, mumps, of course, the measles has been causing a bit of issues in younger people. I don't think as of now it has been causing any issues for older adults. Then the important ones here are pneumococcal 13 and the PPSV 23. So usually in you can say pneumococcal PPSV 23, we can give 1, 2, or 3 doses depending upon the indication again. And PCV 13, usually one dose is given and that might have to be repeated. Then specifically for illnesses, if you have kidney disease, then you might have to take the hepatitis B vaccine as well. It's not like sort of a compulsion that you have to take hepatitis B and hepatitis A. we are hoping in future that even we might, that we have heard a lot of you can say rumble about a malaria vaccine and a dengue vaccine. So if and when it comes, only we can obviously talk about it. Uh, but yeah, this in broad is sort of the recommendation through CDC and WHO. I cannot say that no, we are actually having a definite immunization schedule in India. No, but we are getting there. And I'm hoping that very soon we'll have a separate immunization schedule for older adults. So, thank you. Thanks for your patient hearing. What I can do is I can just maybe briefly, for everybody who might have missed, just go through as an overview. Uh, so, so what I basically covered was as you get older, obviously the immunity tends to sort of decrease, and to sublet or to add to this immunity, it's always better that you get yourself immunized because you might actually stand a better chance in responding to a disease without immunization. Then another very important thing which sort of matters is that it's not only for children. Immunization is not something which is only for children. It is very much there for everybody, and that is something which you should never forget. As you grow older, one of the very important vaccinations which is there is the pneumococcal vaccine, which is against pneumonia, because pneumonia is very common and it can cause a lot of mortality, that is death, as well as morbidity, that is prolonged illness, especially in older adults. So that is something we should always, and that is something we should always keep into consideration. Then another very important thing is that types of vaccination. So that is also a flu shot. There is and also a zoster vaccine. Zoster vaccine is still sort of, you can say, in very much in development. I'm not very sure how many of you have taken it, but that is something which is also coming up, and it's also important because again, it can be very, very painful. Uh, if somebody gets zoster. COVID-19 is, I think, ironically, the one which might have been talked the least in the past is the one which has been discussed the most. So COVID-19 is something most people might have taken, and whoever has taken is good. Again, let me be very, very frank. Vaccines help improving your immunity. They do not guarantee that you won't get disease as well. So there is no sense of immortality with vaccinations. Uh, there is no sense of immortality. There is no sense of immortality in vaccinations. So one has to understand that it adds to your immune system. It basically makes you stronger to battle the diseases. Like for example, there was a study which was done especially for pneumonia vaccinations. So if you have pneumonia vaccinations and you don't have pneumonia vaccine, so the intensity of pneumonia which was seen in people who did not have the vaccination was much worse. They had more days in the ICU, they had more days in the hospital as compared to people who did got the vaccination. So, and then of course, unfortunately, what is always highlighted with vaccinations is the side effects. Now, if 90 people out of 90 people, 3 or 4 get the side effects, and the side effects are obviously put ahead and said that this is what happened, then it would obviously be a very important barrier in your mind to actually whether you should vaccinate yourself or not. And let me just go through the vaccinations which are actually available. One is, of course, the flu shot, which you must take, of course, 1 dose per year. Then the COVID-19, yes, you must have taken maybe a couple of shots. Most people have. A lot of people have also taken the booster dose. Then, of course, the pneumonia vaccine. Now, the pneumonia vaccine, there are two. One is, of course, the PCV13. Another one is the PPSV23. Now, in the if you have not previously got any vaccinations, then 1 dose of the PCV13. So you don't worry about the content. We as doctors will always tell you that this is what you have to take. So for example, that is known as Pneumovac. So Pneumovac is something you can take 1 dose, follow it up by the Prevnar, which is PPSV23 after 1 year. However, if you have already received the Prevnar type, that is the PPSV23, then you can maybe take the other vaccine after a year. Now, if you have already got the PCV13, which I said, then you can get the PPSV23 at least 1 year later. So, and this provides you protection for quite a while, at least 5 to 10 years. Now, another very important thing is in availability wise, of course, is as I said, is the flu shot. Now, another question a lot of people do ask is, where do you get vaccinated? Most of them know that it is going to be in hospitals. You can get vaccinated in clinics as well, even in community health clinics, and of course in government or private sector hospitals and clinics as well. Ideally, there should always be a bit of monitoring. Vaccinations, it's not very easy to full-fledgedly just go start in vaccinations at home forever, because there is obviously there could be side effects, so one has to monitor the side effects as well. So ideally in the clinical setting, because a lot of older people have not necessarily have side effects because of the vaccination, but not necessarily because of giving the vaccination, but because they had some other issue. So when there was monitoring was not there, then they need medicine, they need medical help. So yeah, and the side effects are very common. Of course, the technique in which you are actually given, usually it's usually given here or in the buttocks. Most people usually take it in the hand. I would always say never take it in the hand that you use. Try to take it in the other hand, so that, because even if you have the local pain or for that particular day, that is okay. Or else if you end up taking it in the hand that you have to use, then it becomes a bit difficult because it will affect your activities. You can have a bit of fever, you can have a bit of local pain, you can have a bit of headache. Of course, if these things increase, and even if you have basic side effects, you should report to your doctor, and you will be appropriately, obviously, guided whether you need to do anything more. So that basically was in a nutshell about vaccinations. And I think overall, it's important to understand that vaccinations are adding to your immunity. They are not making you immortal. So I think that is something, if we understand, basically, we still have to take care of your health. It's vaccination is basically a prevention component, which is adding to your health, and that will only help you. Thank you for your patient hearing. I already see a lot of questions in the chat box.
Yeah.
If you have had 3 COVID vaccines, I'm assuming the booster, is it necessary to continue after 9 months?
Again, it's very difficult to say, because as of now, it has only been said that, you can take that extra dose. There is no real guideline in which you have to keep taking it after a year as a booster. So most people in India, as of now, are at 3. A lot of people abroad have already taken 4, because they basically have guidelines wherein boosters have to be taken.
So we don't have any such guidelines. So
as of now, because even the dose has been named as a precautionary dose. It has not been said you have to compulsory take it. So it's like a booster dose in which you decide whether you have to take it. Whereas if you remember, the first 2 doses were always said that you should take it.
Okay, so it has been left optional, right?
Yeah.
Okay. There is a question that's come to me about the COVID vaccine, the boosters, where somebody has said that there is a lot of rumors around the booster that is leading to heart attacks. Would you like to answer this?
Again, it all depends upon. There were not rumors. There was a lot of talk about even the COVID vaccinations causing even maybe heart attacks at that time. But the point is, again, it's in a subset of patients. Even if it is there, for example, some thrombosis was reported, maybe when some heart attacks was, but it's not something that I have seen in my patients. At least most of my patients have actually done pretty well. So a few and far cases would not sort of say no that the vaccine is totally unsafe. But I would still say there is always something that this vaccine has been developed only recently. We are talking about a pneumococcal vaccine, an influenza vaccine, which has been there for years. So we are obviously sort of learning if at all there is going to be more side effects. And same is with COVID. The reason we say things are not in our hand is because this is a 2-year-old baby. It's not tuberculosis, cancer has been there for years together. So we are still, and it's evolving. That's why when the previous question was, if I have to just go back to that question as well, we might need boosters in future purely because this is the pandemic is not over, and if it keeps evolving and it keeps spreading, then obviously we need protection maybe to an extent for life. So yeah, I mean, there have been some reports, but that doesn't mean, don't generalize it that it is going to happen with sort of everybody. And secondly, we have to see what was the profile of the patient, whether the patient already had heart disease, whether the patient was completely fit. So even that sort of matters, whether the patient was actually being in follow-up of the cardiologist. So we have to see the cases which have happened also, what exactly happened, rather than just putting it on the vaccination.
Okay, thank you for clearing that up. There's a question on where could we go to take the vaccine in Chennai. So this could actually apply to most cities. Would you like to answer that?
Yeah, I think first of all, vaccinations will not be necessarily walk-in in the sense that you obviously need a prescription for the same. But a lot of older people have said that I want to take the vaccinations. Obviously, we do a general health profile and then we write it. So yeah, it is available in hospitals. It is available in even clinics. So I would say the best person to sort of contact would be your doctor who's around, and they would obviously direct you appropriately in the city. Whereas, I mean, all the leading hospitals definitely have pneumococcal influenza, that's for sure, because that is something which older adults, everybody gives. So that would be there. And of course, COVID-19, without being said, it is still available. Yeah.
Thank you. So Padma has asked, there are two types of pneumovax. Which one is to be taken?
Again, as I said, if you both are good, but the schedule clearly says that you can take both. So for example, if I have to explain again, I mean, the problem is actually when I said it in that way, it wouldn't be that clear. But ultimately, what can happen is, if I have to say, there are two vaccines. One is, of course, the Pneumovac, and one is the Prevnar. I mean, these are the technical terms so that you don't get confused in the PCV13 and whatever. I mean, that is not something you need to sort of worry about. So if you have not been vaccinated at all, then you can take one dose of the basically the Pneumovax, and then follow it up by the dose of a Prevnar. So that's what I meant. But this can be at least 1 year later. So there has to be a difference of 1 year. However, if you have not received if you have only received the Prevnar, then you'll have to wait 1 year to take the other one as well. And finally, of course, if you have sort of if you have already been vaccinated by the you can say the Pneumovax before, then you can take Prevnar after a year. So the basic thing is, if you have taken only Prevnar, then you have to wait a year, after which you will have to take the other one. But if you have taken the other one, you'll have to obviously wait 1 year to actually take the Prevnar one. So I don't want to confuse you a lot. The point is that if you take one of them, that's also okay. Ideally, you should take both of them, but it depends on which you take first. So that is a guidance that you'll obviously get from your local doctor as well, that when you should take. But both are very good, both are quite effective, and that's why the recommendations say both. They don't say that you take only this or that.
Thank you, doctor. The other question is, if we didn't take the next COVID booster dose, is it important to take the flu vaccine?
Vaccine had to be taken anyways before. I mean, even if the pandemic wasn't there, an yearly flu shot is important.
Okay. Okay, so there's a request. If you could please type out the name of the vaccine that is most important. Is there anything like that? The vaccine that's most important?
If you have to say the names again, I would say that what you should do is you should just ask for the pneumococcal vaccine, and you should ask for the flu shot. That is what would be better as far as the common language is concerned, because those technicalities will only make you a bit confused. But yeah, as far as the pneumonia one is concerned, one is Prevenar and one is Pneumovac. So it might be available in different names in your cities, but usually these are the common two which are available throughout India. That's for pneumonia. And for influenza, it's usually, you can as basically say as the flu shot, and it should be available.
Okay, seniors generally have low immunity levels, thus exposing them to sickness. Is there any one vaccine to build up one's immunity level?
I would love that if there was a magic bullet, but there isn't. Basically, because unfortunately, I wouldn't say that your immunity level is low. The immunity ages, so that's why automatically your ability to fight infections reduces as compared to maybe a younger person. But you can maintain it by obviously maintaining your health, maintaining exercise, maintaining your diet, controlling your conditions that you already have. And of course, immunization specifically, I won't say one shot, but yeah, if you take against pneumonia, if you take against flu, and if you obviously take against maybe zoster, which will come more and more now, and if you take in future, if you have to mandatorily, or we have to take COVID-19 booster shots as well, then it will only add up to your immunity. Yeah, so for the flu shot, it's actually no one is no, there is something known as Vaxi grip, and one is also known as the Quadri flu vaccine. So these are the two names usually. So you will obviously have to just check it up locally. That's
Okay.
for the flu shot. Yeah.
So best to check with your doctor, right? That's the first step.
Yeah.
Okay. Lakshmi has asked, what do these vaccines cost?
Cost again will be quite variable. For example, if you go to the government setup, then obviously it will be either it might be as much as even free, or maybe it might be at very nominal cost. But and both the vaccine, the cost sort of differ. But if I have to just tell you maybe in broad, that maybe how much one shot, for example, if you're talking about maybe a Prevenar 13, so that will cause around, a single shot will cause you around 3,400. That is the injection, of course. And if we talk about the Pneumovac, which is the one, which is another type of vaccination which you sort of take, that is known as the Pneumovac 23. So that is also on quite similar lines, but basically around 3,000 to 4,000. But the subsidy will definitely there for older adults. The Pneumovac is comparatively cheaper. It is around 1,700. Of course, there would be a subsidy for older adults. Usually, it's always there in hospitals. So Pneumovac is cheaper than the Prevnar 13. But effectivity wise, both are pretty similar. So, that's the difference. And I think flu shot is also very much within the same range, around 2,000, 3,000. Again, it will sort of vary in which setup you sort of take it.
Okay, thank you. There's another question. Should the flu shot be taken first, or the pneumonia one? Which one to be taken first?
There is no particular order, because flu shot is usually taken just before the sort of flu season, and so that's not a problem. And pneumonia can be taken maybe before or after. So it's not really something that's a real rule only that you have to take this before or after. But usually we always try to give a bit of gap between giving two vaccines. So that gap has to be sort of maintained.
Thank you, doctor. Another question from Daisy is, do we need a prescription, or can we just walk to a hospital?
I think a prescription would always be needed because usually the dose is written where it has to be given. It is written with your name, so it's always better to actually have a prescription. Yes, if you go to a hospital and you don't have a prescription, that doesn't mean they will refuse you. Obviously, you'll have to meet a doctor there, and they will write the. I mean, they will obviously examine you and write the prescription and give you. So if you just walk in, it's not going to happen that they'll just say no, you can't come. You obviously will need a prescription to get it because obviously it's an injection. So it's not something you will get over the counter. You won't even get the medicine without a prescription.
Thank you, Doctor. Sushma has asked, the new strains of the flu vaccines come out every year, very late in the year in India. Is it still worth taking it?
Yeah, I basically think it is still worth taking it because it'll always be helpful. And our worry now is, of course, flu and COVID even coming together, because that is another worry, which is sort of because both are caused by different groups of different groups of viruses. So yeah, I mean, there's no harm in taking.
Thank you. The other question from Medha is, if we take influenza and pneumonia, do we need to take COVID booster regularly?
Again, we are talking about different diseases here. COVID is entirely different. So it's like telling me you like to eat oranges, but you would take mangoes instead. So we are talking about different diseases here. So taking a COVID-19 booster is not going to protect you from influenza and pneumonia. All of them. I mean, yes, pneumonia is basically caused by bacteria, influenza is a virus, and COVID again is a virus. But your overall immunity will be boosted specifically against these diseases by taking them. So it's you can't say that you take COVID. I mean, if you take influenza and pneumonia vaccines, then you should not take the COVID. No, that doesn't work that way.
Thank you, Doctor. At what interval should the flu shot and pneumovac be taken?
Flu shot and pneumovac vaccine interval. I mean, it can vary. Usually, of course, the good part about a flu shot is that we can actually we have to take it only yearly. So the timing, anyways, automatically it doesn't happen that an older person will take it sort of back to back. But as far as spacing is usually concerned, we have to sort of give at least, maybe you can say, anything more than around 4 to 6 weeks, even before even sort of thinking. Simultaneous administration is not something we sort of try to do, because it will not involve giving the vaccination. I'm just answering that as well. If anybody asks in future, that it will obviously not involve giving it, of course, together. That will never happen. And secondly, you'll have to involve two sort of sites in your body. For example, if you give it here in the hand, then that doesn't mean we can give it again to you in the same hand. So we'll have to obviously give it in a different place. So that's how it has to sort of be done. But simultaneous administration, as far as older adults are concerned, we don't try to do it. We try to avoid it. If you see in younger people, then DPT is given together, but that's for younger people. So we usually don't take that risk for older people by taking it together. Sometimes, yes, travel vaccines might have to be given. So, for example, if somebody uh, travels abroad, you might actually have to take a Japanese. You might actually have to take maybe a vaccination against hepatitis. You might actually have to do, depending on certain countries that you travel, even Japanese encephalitis. So in that case, you might actually have to sort of try to space it out. You can wait for your sort of flu shot, if your yearly flu shot and just combining, and then you can sort of take it.
Question several from Arun Malhotra. Several doctors at clinics feel that the vaccines are safe even if delivered at homes by technicians with no supervisions required. Can we ask for vaccines at home?
Again, I'm not if they are ready to obviously take the responsibility, and you are ready to take responsibility, that if anything happens, that is not going to be. If the doctor will not be liable for it, then I'm sure the doctor is going to be okay with it. But as far as I am concerned, usually it's not about the safety of the vaccination. The vaccination is going to be safe. It's about after giving you whether you actually develop an allergic reaction, and if something happens, that home might not be the ideal setting where we can give you injections or where we can give you things immediately. So it's basically trying to prepare you for the worst. That's why even in COVID, if you said, people used to go and after the vaccination maybe wait for half an hour, and they were all the numbers were obviously sort of kept as well, and you were told to report if you had any fever or if you had any other side effects, because that was important. So to say that it will be entirely safe at home is difficult to say, because it's not only a fit elderly we are talking about. It could be an older person who must have multiple diseases and then giving the vaccination, so that could be a risk. I wouldn't say rule it out completely in future, but I wouldn't absolutely give it unsupervised. It would always be better to have somebody around, especially maybe a nurse for that particular time. If anything happens, monitor the vitals before, monitor the vitals after, see if there is any allergic reaction. And then the thing is, if it is unsupervised, then you people might not be able to recognize also if there is a side effect. And if that happens and it leads to something more serious, then that can be an issue. But yeah, more and more, I mean, more and more in future, maybe it might happen, but definitely under a bit more surveillance.
Thank you for the doctor. Okay, there are two other questions. How often do we need to take the hepatitis vaccine?
Again, hepatitis is usually quite specific, like people with HIV, then people with kidney failure, people to an extent with heart disease as well. They are supposed to sort of take it, people with maybe even liver disease. So overall, it's usually 3 doses which are spread throughout, but normal people not necessarily do take the hepatitis. Like we as healthcare workers, we also sort of tend to take the hepatitis B purely because we are exposed to quite a bit of patients, and we are not very sure whether the hepatitis should be, I mean, whether the person we are treating might or might not have hepatitis.
Okay, okay. I see a follow-up to your hepatitis vaccine, 3 doses at what intervals?
Again, I would say it's specific to the person purely because not everybody is given the hepatitis B vaccine. If you obviously have a kidney disease, if you obviously have a particular, I mean, risk factor, whether there is a kidney disease, whether there is a liver disease, whether you're immunocompromised in any way, then it is usually sort of given. I mean, if you have to, and there is different categories. So, for example, there are guidelines and recommendations for people between 19 to 59 years, and adults above 60 years usually, who have risk factors for basically hepatitis, only they are supposed to sort of take it. Now above 60 with risk factors and without risk factors, it is usually sort of very specifically seen whether you need to sort of take it. Now if you ask about the doses and how many times, now as far as I think above, if I have to just put it into older adults who are, I mean, who are not having any risk factors. I mean, we have to divide it into sort of both. Then usually it can be given at standard is 3 doses, basically at 0. That is 0 is the first dose, then at 1 month, and then usually at 6 months. So that is what we usually sort of give. But again, if it is people who are, for example, on hemodialysis, then usually again the same sort of thing might be followed and they necessarily need it. So if you really want to take it, then this is sort of the dosage 0, 1, and 6. So that will be 0, the starting, then 1 month, and then 6 months.
Okay, thank you, doctor. You have answered this, but probably the person joined late. What about shingles vaccination, which is herpes?
Shingles, again, I think is very important. Usually it's a single dose. It's a single dose vaccination that is given. And I mean, that's about it. And that should give you protection. If people have suffered from herpes before, then of course there are antibodies which will be there and you will get protection. But a lot of people continuously keep getting also. So that can be a bit of an issue. So yeah, it's definitely protective against. And if for people who have never got, there are certain people who have never got chicken pox at all when they were children, and then they get zoster when they are old. It can be very painful and it can be really debilitating. Also, there have been a lot of older adults who have really not been able to recover of the pain because of shingles. So that is something you should be very careful about.
Thank you. One last question from us. This is such useful information, but we barely hear about it, right? Even from, medical professionals many times regarding older adults and how useful this is for them. Would you like to just wrap as you wrap, would you like to talk a little bit about why such low awareness about vaccination for elders?
I think if you would have told me to tell this 2 years ago, I would have said there is low awareness, but I think the pandemic has changed a lot of things. Uh, I would say the fear of life and the fear of loss, not only their own life, but their children. And I'm talking from a perspective of an older adult. Their children and family has made them read even more about it. And I always believe that older adults can adapt. So obviously, there is nothing to say that they were against vaccination. It's that they have not been sensitized and provided good knowledge about it. That's why they were not sort of wanting to take it. And at the end of the day, as I told, the fear of an injection will always be there from a child to the time you die, because an injection is an injection. So I think the overcoming of the barrier would be through proper sensitization. Of course, this is one platform. Then I think people who take it are the ones who have to be real advocates, because if they have taken, they have benefited. Now, the benefit is not saying that I took pneumonia, I took the pneumococcal vaccine, and I didn't get pneumonia. If you didn't get pneumonia, it's protected you. If you got pneumonia and you obviously overcame it, then you are able to sort of even give from your personal thing that no, I actually recovered with pneumonia, maybe because of that. But the bottom line is we tend to just relax a bit if we take the vaccination. Now, what happened with COVID-19? A lot of older people thought, no, I have taken the vaccination, now I won't get COVID. No, but that is not the point. The precautions always had to continue. Like there were examples of people getting COVID when they visited the centers. It was not for vaccination. It was not because of the vaccination. It was because there were centers in which maybe they had not worn masks, or maybe there was a bit of crowding. Initially, it was a bit of a mess, obviously. But later, when it got organized, it was better. So it is very easy. It was very easy to blame it on the vaccine. But one has to say that one has to keep taking the precaution. So I think the only way you can overcome any amount of barriers would be to get knowledge, not necessarily through Google, but to list your doubts and ask your doctors, ask your geriatrician, and ask people who can actually give you good knowledge, and not on the Google and WhatsApp forwards, because those are not certified knowledge. So I think that is very important. And secondly, always you can take the advice of your doctor before you want. It is not necessarily that the doctor has to tell you, because we are now in this day and age where you also have a lot of knowledge, and that's good. But we are always here to guide you. And of course, as a geriatrician, I always profess that you should take your vaccinations, purely because it is only giving you a better chance against the diseases. It's against you getting a disease, getting admitted, and I mean, worst case scenario, being there in the hospital for long, or you being vaccinated, getting a disease, getting protected, and maybe coming back home earlier. So I think that is the thought process you should sort of take. So I think knowledge is power. So the more knowledge you are able to gain about it, the more you will be obviously able to ask doubts also. I believe that knowledge you get, you will have doubts. The more knowledge you have, the more doubts you'll ask, and then you will be obviously able to clear. Because I feel that in older adults, it's not that they don't want to do things. I mean, this is just a general statement. It's that if we provide them knowledge, if we provide you knowledge about why it should be done and why it should not be done, pros and cons, and then it gives you a more analytical sort of thought process, and then you are able to take a better decision. So we are here to obviously give you that decision. And finally, vaccination is ultimately never going to be forceful, because it's not. It is an initiative which you should take. We will give you all the knowledge. We will tell you why it is important. But it should always be your decision, because it's not a paternalistic thing. You can independently take your decisions. But whatever decision you take, you should live with it. you can change your decision also. That is another thing I'm saying. If you're convinced about vaccinations later, take your vaccinations. It's not something which is like glaring. A lot of older adults feel, okay, earlier I just refused to the doctor. I was like, no, there is no use of it and all. So they don't go back only. Don't do that. Go back, take your vaccinations and be safe.
Thank you so much, doctor. This was very, very informative. And